Hi, I'm Dr. Eric Bates. I'm a foot and ankle surgeon at Seaview Orthopedics. I've been here for about 8 years. Today we're going to be talking about flat foot and how to treat it properly. It's a very common deformity and not always painful. Some people have flat feet and they're quite functional. What we mean when we're talking about a flat foot is something without an arch. And the arch is something that is in the middle of the foot. It's between where the metatarsals are and where the heel is. And a normal arch, it stays off the ground for the entire time that you're walking, at least part of it. A flat arch will contact the ground either immediately when you put your foot on the ground or at some point during the gait cycle. Some people have this and have no problem with it whatsoever. Almost all children have a flat foot up until about the age of 5 to 7. It does not need to be treated. It usually resolves. If it does not resolve, then, and if it's painful, then it's something that can be evaluated and treated by one of our specialists at the practice. Typically, when people are experiencing pain from a flat foot, they'll have pain from one of the soft tissue structures initially that helps support the arch. If you think of a Roman arch, which is made of stones, the stones are rigid and held together by their natural shape, but our foot has to actually move. So we have somewhat of a loose Roman arch, which is then held together additionally by 3 primary structures. One of them is a ligament that holds the heel to the midfoot. Another is the tendon called the posterior tibial tendon. It's a lot like the Achilles tendon in its function, but a little different in that it holds up the arch. That's what's called a dynamic stabilizer because it moves. The plantar fascia is the third main support of the arch, which goes from the heel all the way to the toes. This is a semi-dynamic stabilizer in that it does flex and extend, but it's mostly static. It stays in one place. And so when people have pain, they typically have pain in one or more of these structures. And that would be pain around the inside of the ankle, pain on the bottom of the heel, or pain up the leg. These things can be painful temporarily, and if they go away quickly, then there's no need to see a doctor. But if they remain painful, it's helpful to have somebody to look at your foot and figure out what could be causing that pain and what you can do for it. Typically, when we treat a flat foot, we start with things like bracing, which will really help to stabilize whatever structure is inflamed, which will give it a chance to heal. We can do an over-the-counter soft orthotic, or take a look at your shoes and make sure that the shoes that you're wearing are good and stable and not too flexible to allow the posterior tibial tendon or another structure to get fatigued or painful. And then sometimes if that's working for you, you can interchange these things throughout your routine to stabilize and help support your foot so that the tendons, the plantar fascia, and the ligaments can heal and get better. And this may need to be something that you do over and over again throughout life when things start to hurt. When we get to the point where all the conservative management has failed, we like to categorize our flat feet into different groups. First, we start with whether it's a congenital deformity, something that you're born with. That can be something like a neuromuscular phenomenon. Something like cerebral palsy is a very common cause of a flat foot, and that would need to be treated a little bit differently than one that's more mechanical in nature. A mechanical flat foot can come from all the way up from your spine. If you have scoliosis, that makes one of your legs longer than the other one, and your foot will accommodate for that by flattening. You can also have femoral anteversion, which can cause the leg to rotate in a way that causes the foot to pronate. The knees can be in valgus, which is when you have knock knees, and that can also cause you to flatten the arch. The tibia can rotate as well, causing the foot to flatten, or the problem can be contained only in the foot. We also have, especially with congenital deformities, very rigid feet if there's something called a tarsal coalition. That's 2 bones that are joined together in the foot that really should be separate, and the foot responds by flattening in order to get more motion out of the foot. The other category is an adult acquired flat foot, and those can come in rigid and flexible varieties as well. But these are flat feet that get worse and worse throughout time because the structures that are the soft tissue elements holding the arch up are starting to wear out. And as they wear out, they get more and more diseased and more painful, and you can develop arthritis in the foot. When you're treating this type of a problem after conservative measures have failed, it's really important to categorize properly stiff, rigid versus flexible, because you can either do just a tendon treatment, which is to clean up one of the tendons that's irritated or inflamed or possibly torn by just repairing the tendon, or you may need to shift one or more of the bones around, and you can do that without fusing any joints, meaning you keep all the joints moving by just moving bones around. And that can be done with what's called an extra-articular flat foot repair. That's done by moving the heel in a couple of different positions and possibly something in the forefoot. That can be combined if the foot is either very loose or very arthritic, with fusions of whatever joints need to be fused. And what a fusion is when we take two bones that typically move freely and we join them together for good so that the foot remains more stable. If the arthritis is so advanced that it involves both the foot and the ankle, and all are flattened, then you may need to actually fuse all of the joints in the hind foot and even the ankle potentially, or replace it depending on what is allowed by the foot mechanics. Typically after a reconstructive effort such as that, it's a long recovery. We're looking at around 8 to 10 weeks of strict non-weight bearing, followed by another equal amount of time in physical therapy, such as 8 to 10 weeks in a boot with therapy. Typically, this is the last resort, and we try to do everything we can to avoid surgery with this, and not everybody is a good candidate or really needs surgery. So to wrap things up, flat foot deformities are extremely common. They can cause all kinds of problems with the foot and ankle if they're left untreated, but if they're not painful, we really don't typically need much in the way of treatment for it. There are lots of things that can cause these problems. So if you're starting to feel pain that's unrelenting or other symptoms that you don't find to be normal, you should come to us at Seaview Orthopedics and have it looked at, and we'll take good care of it and make sure we do everything we can to treat it properly. We take these problems very seriously, and we take a multifaceted approach to determining what your best treatment should be.